Production funding for Another View comes from the Hampton Citizens Unity Commission, using the time, talents, and skills of a broad base of citizen volunteers to help break down racial and cultural barriers, working to achieve the City of Hampton's community plan for a healthy, diverse community. And from the African American Programming Advisory Group, community visionaries assisting WHRO to engage, enlighten, educate, and entertain all communities in Hampton Roads. And now, Another View.
Hello, everyone, and welcome to Another View. Here's a question. What disease in men has a 90% cure rate if caught early, but occurs more often and is more deadly in African American men than in men of other races? The answer is prostate cancer. And here's another fact. The peninsula ranks number 3 in the highest number of prostate cancer cases, and this disease ranks number 1 of the top 10 cancers among males in Virginia. So what's the deal with this disease, and what should we, both men and women, be doing about it? Joining us to discuss the myths and the facts about prostate cancer are Charlie Hill, a prostate cancer survivor and president of the Hampton Roads Prostate Health Forum, and Dr. Mark Fleming, an oncologist with Virginia Oncology Associates. Now, let me give you a word of caution. While we will use correct medical terminology, we're going to have a frank discussion about this disease, so it may not be appropriate for young children to be in the room right now. Gentlemen, welcome to the program. Thank you so much for joining us. Let me start with you, Charlie, because you have a personal story. Before we get into kind of the medical aspects of prostate cancer, you are a survivor, been a survivor for how many years now?
6 years.
6 years. Tell us a little bit about what happened. How did you discover that you had the disease, and what that process was like?
First, thank you for the opportunity to be here and share what we're doing with the Hampton Roads Prostate Health Forum. I was diagnosed in June of 2002, actually by accident. It was simply a matter of going to my doctor following a number of conversations about the increase in my PSA values. However, they were not way out of line. I was measuring the rate of increase, yet I was diagnosed with prostate cancer with a 2.1 PSA.
That's low.
Very low, based on the current thinking at the time. And that was really an eye-opener for me. I had no idea that I even had cancer. I wasn't sure of how that would come about. And as a result of this shock, we began the search and began to understand more and more about the disease. I eventually ended up at Johns Hopkins and had a radical prostatectomy, which was open surgery to remove the prostate gland, and did fairly well for a period of time. And shortly in 2006, I had a reoccurrence, which was a second shock. And today I'm sitting here with a PSA of less than 0.1, but wondering what's next.
Wondering whether or not it will reoccur.
Yes.
Okay, let's kind of go back to the basics for a minute. Dr. Fleming, what is prostate cancer? In layman's terms, as much as we can.
The prostate is a gland that's only in men, and it's a cancer where the prostate is growing abnormally and within the gland, and hopefully it's caught early and that we can do something about it. But PSA, as Charlie mentioned, helps us in some cases in terms of finding cases prior to its advancing and spreading.
So the PSA really it's a blood test, am I right?
Yes, PSA is a blood test, but I always say that the PSA, the normal prostate, I have a PSA level right now. Doesn't mean I have cancer. And Charlie's an example that people can have low PSA levels. 4 is typically the cutoff that historically has been used. But Charlie brought up some good points that as we understand more about this disease, it's really the rate of rise and the velocity, the rate of change of the PSA is probably more important than the absolute number.
Now, you recommend, or it is recommended, that there are 2 tests that men should take, am I correct?
Yes.
In order to determine what's going on with the prostate. One is the PSA, and what's the other one?
The second one is the digital rectal exam.
That's the one that men always go, ooh.
That's exactly right. And, but it's a good ooh if you consider identifying a problem early enough to either get the proper treatment and move it behind you. So it's a ooh worth having.
Dr. Fleming, this disease can affect any man.
That is correct.
Why is it so high in the black community?
We don't know that. I think research is trying to investigate that, but we don't know why African American men, it happens more predominantly in us. We just don't know.
So there's no common thread, there's no common factors. I've read somewhere some people are thinking it's because black men tend not to go to the doctors as often, you know, in terms of catching it or in terms of its progress, I guess.
There are a number of factors, but I think Dr. Fleming is right on point. I mean, age could be a factor, genetics could be a factor, environment could be a factor, but until we have more information, one of the reasons that we are excited about the opportunity here in Hampton Roads is to direct some research on this particular question and try to get an answer that works. But we don't really know why here in Hampton Roads and on the peninsula in particular. We don't know.
So there's no studies that have been done thus far that can really pinpoint?
Not that we are aware of. Correct.
Wow. So when you found out that you had the cancer, then you had to make some decisions in terms of how to treat it, because there are many different treatments, correct?
Yes.
Yes.
Why are there so many different ways to treat prostate cancer? Let me start with you, Dr. Fleming.
Well, I think it's a good thing there's a lot of different ways. An analogy I use is I'll ask a patient what's their favorite car, and if they have their spouse with them or a significant other, I ask them what their favorite car is, and often you get two different answers. Mm-hmm. And the way I approach it is that the best answer for you in treating this disease, it varies, because we have some good choices. Simply, some of them are surgery. There's radiation therapy. There's many different types of radiation therapy. Seed placement, or what physicians would call brachytherapy. There's external beam radiation therapy. And a subtype of that external beam radiation therapy is an evolving one called proton beam radiation therapy.
And proton therapy, that's one of the latest types of treatment. Is that correct?
That is correct.
As a matter of fact, over at Hampton University, they're building a proton therapy center.
Yes, they are.
If I'm not mistaken. And once it's done, it will be the largest freestanding proton therapy center in the area, or actually in the world, according to their materials. And the proton therapy actually goes directly to the cancer. Is that how it works?
Yes, all of the radiation techniques do that, but it's kind of beyond my kind of level of education. I'm not a radiation oncologist, but protons is a different way to deliver radiation therapy, and theoretically it has some enhanced opportunities to treat it that way.
So, Charlie, I have all these choices. I'm a man. I have all these choices. I could take surgery, or I could do radiation, or I could do many different things. How do you decide? What did you decide?
That's really the challenge, and I think it is very good to have a lot of choices. It is not so good to have to struggle with how do you make that decision. What I did was interview people. I interviewed a number of cancer patients, prostate cancer patients, healthcare professionals, and others who could help me understand what the choices really were at the time and how they could apply to me. There were a number of variables that were not clear to me at that time. I spent an enormous amount of time and effort, and I had resources to apply in that direction, so it made a difference for me. We would like to make that struggle a lot simpler, make that research a lot simpler, so that all of these fine resources in our community can be accessed more efficiently, so that men will get what they need fairly quickly.
Well, I would imagine, because you're already nervous or afraid because you've just been told you have cancer, and then you get all this information kind of laid out in front of you. One of the goals of the Forum Institute is to have somebody kind of walk you through that. Is
Absolutely.
that right?
Our forum will bring to the Hampton Roads area a navigator, and this person will help the patient once he learns of his diagnosis, and will help assist in navigating through all of these different options for treatment, and include the women in the lives of the patients as well. But that's really one of the unique characteristics of what we're trying to get done, which is what I did not have done, or did not have available to me back in 2002.
Dr. Fleming, you're always told to get a second opinion. Now, you tell me if this is true. You're an oncologist. Would you approach it from one perspective versus a radiologist who would approach it from maybe another perspective? Or so how do you, is it really a matter of what works for the individual? Because you're still getting all this information. Nobody's wrong, correct?
Well, if with someone who has a localized prostate cancer where the goal is cure, A medical oncologist is really not involved in terms of the treatment aspect. Where a medical oncologist like myself can help is that we can provide perspectives that in the end, I'm not going to benefit from whatever treatment that the patient gets, at least financially. So I actually think it's a great opportunity to speak to a medical oncologist because they can talk about, from an unbiased perspective of radiation, surgery, and they can point you in the right direction and kind of ferret out some of those issues that a patient might have and saying, well, I don't want to get cut on, I don't want this, I don't want that. So I do think a second opinion is helpful, but I do think that the approach should be like Charlie is, talking to a radiation oncologist, talk to a surgeon who does that surgery. Is called a urologist. It's very beneficial in terms of getting a different perspective.
It's now thought that men, particularly African American men, should have the PSA test and the DREs done at age 45.
Yes.
Where others are at age 50. Is that, what's the reasoning behind that?
Simply being black, you're at a increased risk factor. If you have a family history, also increases your risks. And so screening per se, you want to try to get a group of people who might have a higher likelihood of having a cancer. So I have many men who are in the age 45 range that they have prostate cancer. So we need to start screening at that time.
I would also add, though, that you don't have to be black. If you have a family history
That's correct.
of prostate cancer, and if you're white, you should also get screening done.
Yes. And get it done early.
Yes.
What does PSA actually stand for?
Prostate-specific antigen.
Okay, and that's what's found in the blood.
Correct.
The enzyme, is it an enzyme or is it a, am I saying that right?
Yes, yes, it is an enzyme.
Okay.
Yes.
All right, Charlie, your favorite subject.
Yes, yes.
Let's talk about the women in these men's lives and how can a spouse, a significant other, help a man who is facing prostate cancer?
Generally, when a man learns that he has prostate cancer, there are two things that will come to his mind. Will he be sexually functional, and will he be able to control incontinence? And I would say to you that the sexual function trumps the incontinence. He wants to know, how will whatever is happening to me affect my performance? The women in the lives of these men can be extremely helpful in reassuring them that as they make the key decisions, that they're going to be in their corner. If a man does not have a woman in his life or another significant other who would be very helpful when he's making those decisions, he is likely to make a bad decision or a short-term decision, or he's likely to miss something that's extremely important. You really need to have someone to talk with when you're making these decisions.
And you have to be able to have a frank conversation.
Oh, yes. It's a grown-up conversation. It really is a grown-up conversation, because in most cases, typically when you have a prostate cancer, regardless of the treatment protocol, it is very likely that you will either have some temporary or some permanent incontinence, some temporary or permanent loss of sexual functioning. And I think that conversation needs to come out early on in the discussion.
Now, this is a disease that primarily affects men, older men. Is that correct?
Yes, age is by far the greatest risk factor.
Okay, but that doesn't mean that they still don't have an active...
45 is not old, Barbara.
Oh, I agree, trust me, since I'm past 45 now, definitely. Dr. Fleming, you brought some models here, and one of the things that we hear a lot about in terms of advertising and so forth is the enlarged prostate versus prostate cancer. Can you tell us very briefly what the difference is between the two, and is an enlarged prostate necessarily going to lead to prostate cancer, or are they two separate things?
I can tell on it. I brought some models on a digital rectal exam. I can tell the difference between this here is a normal prostate, and it's healthy looking, and people with mild BPH can get a little bit enlarged, and there's some swelling.
BPH, that's the enlarged.
That's
prostate.
the enlarged. And prostate cancer, I have another set of models that you can actually feel a nodule in many cases with men with prostate cancer on the digital rectal exam. So it is something that a primary care physician or urologist, medical oncologist, those of us who treat a lot of prostate cancer, we clearly tell the difference when something is cancerous and when it's not.
Okay. Talk to us a little bit about the testing so that we can put men's minds at ease in terms of what exactly is involved, as much as you can describe, and why they should not be afraid of this.
Simple blood tests for the PSA. For the digital rectal exam, the doctor takes a well-lubricated glove finger and insert it into the rectum, and you're able to palpate the prostate. I would say it's uncomfortable. I've had it done myself, but it's nothing that you're not going to be thinking about that night. I mean, it's something I think needs to be done, and I think there's a little bit of discomfort, but men get used to it.
Charlie, what would you tell men if you had 2 minutes, which is about how much time we have left, to talk to men and really encourage them to go and have the testing done and to take these steps? What would you say to them?
I would say that you're looking at me right now because my cancer was detected very early. I had the DREs, the PSAs. I mentioned earlier, my PSA was 2.1. I would want men not to be comfortable just because their PSA is in that range of 0 to 4. I would not be comfortable. If you have a family history of cancer, or if you're an African American, then I would say at age 45, get into a screening of the appropriate screenings in both screenings, both the PSA and the DRE. I would also say that if your primary concern is sexual function or incontinence, please reach out and talk with someone who can help you. There are plenty of folk who can help in that area. We hope to be available through the Hampton Roads Prostate Health Forum to talk with those men who are interested in learning more about that. There are so many choices, certainly in this region now, in 2009, that we did not have even in 2002. So I would encourage men to extend their lives, extend the quality of their lives by reaching out and talking with someone who can help them now.
Thank you, gentlemen, so much for coming on to Another View and sharing with us about prostate cancer. And as forums and so forth come up, please let us know so that we can let our viewing audience know about this and about what's going on. Thank you so much for joining us.
Thank you.
And that's Charlie Hill, president of the Hampton Roads Prostate Health Forum and prostate cancer survivor, and oncologist Dr. Mark Fleming. When we come back, some news to help your eyes and your mind. But first, let's check out what's happening in Hampton Roads. Welcome back. In tonight's lifestyle segment, we have some spiritual advice on dealing with mental illness. But first, we'll talk with optometrist Dr. Christina Ramsey about another disease that runs rampant in the Black community. It's glaucoma. According to the experts, if all of us would simply take some positive steps, like seeing a doctor early, taking medication as prescribed, and lowering high blood pressure, we could bring glaucoma under control in our community.
Barbara, I'm here with Another View's expert when it comes to the health of our eyes, Dr. Christina Ramsey. Dr. Ramsey, welcome.
Thank you.
And we're going to discuss a problem that's very prevalent in the African American community, something that can sneak up on you and steal your eyesight, glaucoma. Dr. Ramsey, what is glaucoma?
Glaucoma is a disease where the optic nerve inside your eye is damaged most of the time from high pressures inside your eye. And the optic nerve carries images from what you're seeing to your brain. This is the normal optic nerve. If you could see that there's the cup inside is a nice size, about half the size of the whole circle here. And in glaucoma, the cup actually gets bigger and it covers up the whole cup here. And so that's where you're losing the side vision.
Who does it affect?
It affects everybody, but African Americans tend to be 3 to 4 times more affected by glaucoma than Caucasians or Hispanics. So one of the tests we'll do is for you to cover up one eye, and we'll mark if you've lost any side vision or not. And that's just a flash of light and in different points of view. And we'll also measure the pressure inside your eye, either with that famous puff of air or with another drop in your eye.
What kind of treatment is out there?
Most of the time, we'll first start you on drop therapy. We'll give you drops. You'll put them in your eyes, sometimes just once a day, and it'll lower the pressure inside your eye so that we can prevent any further vision loss.
Barbara, I'm here with Dr. Melvin Mariner, the pastor of Grove Baptist Church and another Views expert when it comes to spiritual matters. Dr. Mariner, welcome.
Glad to be here, Lisa.
What can you do to help a family member or even yourself when it comes to mental health?
You know, I think that when you deal with spirituality and mental health, you have to see how can spirituality aid in those who have mental health issues. And it is a proven fact that one's spirituality helps resolve some of the mental health issues or even prevent some of them. How one is able to somehow learn to simulate coping methods so those issues may not occur sometime. I think being spiritual would understand there is nothing wrong with seeing a psychiatrist or a psychologist. There's nothing wrong with seeing a counselor who perhaps can also aid in getting us at least on the right track. I think that when we deal with the spirit and spiritual issues, sometimes we just want, okay, God's going to fix this right away. God will fix it. But God may have someone to assist him that he's giving knowledge to, who have skill, insight, training. The expertise is trying to manage this person in their mental health issues. So I think one of the things for spiritual people to understand, it's okay to reach outside of the local assembly called the church and get help.
Some great advice from our lifestyle specialists. Now, according to the U.S. Census, less than 20% of Americans have a college degree, and the number for African Americans is even lower. But one local church decided that that needs to change. So last October, First Baptist Church, South Hill in Chesapeake, started a college prep program. It's designed to teach young people everything from how to select a college to how to pay for it. As Lisa Godley tells us, right now more than 70 students, grades 8 through 12, are enrolled in the program, and many have already been accepted to the college of their choice.
It's my position that you can't start early enough. I mean, birth, you should start reading to them, taking them to campuses and letting them know that it's not an option. This is something that's for you.
So when Vivian Washington's church announced they were starting a program to prepare students for college, she was all smiles.
My first gut reaction was, this is for me and Hassan. I have 2 other kids, but he's my immediate concern because he's in the 10th grade. And so I knew right away that that's what I needed to do.
According to the program's executive director, LaToya King, Phase 1 of college prep targets 8th through 12th graders and works with them and their parents to prepare for college both academically and financially.
What we have done is the students register for the program and we ask them what type of grades they're making. We ask them what their SAT score is or if they've taken the SAT. And so if we notice that our students are making C's or D's or they're struggling, then we will, suggest that they, participate in the tutoring. However, if the students are doing very well, we will continue to encourage them to stay on the honor roll, participate in certain organizations like National Honor Society so that they can better prepare to be accepted to the college of their choice.
The program also takes steps to help students select a career and achieve their goal by bringing in professionals who can give them a first-hand account of what a particular job entails and inform the students of the kinds of courses they'll need to take to get there.
We met a lot of professionals, pharmacists, Marines, a lot of people who really like their careers, and they were really professional, and they helped us, showed us how they do their job and how much they like it.
I saw some growth in Hassan right away. I saw him exploring options that I never thought that he would even consider. Maybe the 2nd or 3rd session, I saw Hassan really well, his interest was piqued, and he was leaning forward, and he was listening. This is a young man who spends a lot of time with video games and just zoning out and tuning people out. But during this program, he was really engaged, and that was important to me.
King says Phase 2 of the program will target 5th through 12th graders and will begin in the fall. Hassan plans to attend George Mason and major in music, and he's thankful to college prep for exposing him to so much more.
It gave me some more choices of what I wanted to be when I got older. So if musician doesn't work, I'll try something else.
As for Mom, she can't wait to bring her younger daughter into the program.
You're going to learn something, you're going to be involved in something, you're going to be somebody. And so the earlier the better.
For Another View, I'm Lisa Godley.
First Baptist Church South Hill is hosting an open session for anyone who's interested this coming Sunday, February 22nd at 1:30 in the church's fellowship hall. The church is located at 3633 Galberry Road in Chesapeake. Now you can call 757-545-0326 for more information. And we also have additional information about the college prep program on our website, www.anotherview.tv. And while you're there, blog us and tell us what you think about the show. Or email us at anotherview@whro.org, or you can write us at 5200 Hampton Boulevard, Norfolk 23508. Next week, we'll talk about the high unemployment rate in the African American community. We'll see you next week for Another View. And please, if you haven't seen a doctor lately, see one. Your health is so important. Good night.
Production funding for Another View comes from Hampton's 400th Anniversary Committee and the Hampton Neighborhood Commission, partnering with neighborhoods throughout the city, working hand in hand to create vibrant places we are proud to call home and celebrate. And from the African American Programming Advisory Group, community visionaries assisting WHRO to engage, enlighten, educate, and entertain all communities in Hampton Roads.